Hello everyone. In today's video, we will discuss regarding the pharmacotherapy of constipation. Often, whenever we think of symptomatic treatment of constipation, we prefer laxatives, which are also called as purgatives. And we know that there are numerous options available like lactulose syrups, syrups made up of milk of magnesia, etc. But often what happens is we will not be thinking too much about this composition, and many a times we will not instruct the patients regarding the right timing of intake of these medications. So these factors might lead to the improper compliance and inadequate results. So it is very important to focus upon the basic mechanism of all these medications. And most importantly, always try to find out the cause for constipation. For example, any infectious diseases or hormonal imbalances like hypothyroidism or some acute abdominal conditions where if we focus on the underlying cause, the condition will improve automatically. But as a measure of relief, we have to know the basics of laxatives. So we'll discuss it in today's video. First of all, for helping out in evacuation, we have mainly 4 classes of medications. That is bulk forming agents, osmotic laxatives, stimulant and irritant laxatives, as well as stool softeners. And as the name indicates, these bulk forming agents will increase the stool volume to stimulate natural peristalsis. And the osmotic laxatives will draw fluid into the intestinal lumen via osmotic pressure, thus helping in the evacuation. The stimulant and irritant class of medications will directly trigger the neurons in the GIT and also stimulate the secretion of numerous electrolytes, thus helping in relieving constipation. And finally, regarding stool softeners, these will mix aqueous and fatty substances to lubricate stool. We will learn in detail about all these 4 classes. First, we will see about bulk forming laxatives, mainly the dietary fiber, which is non-absorbable and water attractant. So what it will do? It will increase the bulk of already formed stool. So by increasing the bulk, there will be distension of gut. That will stimulate the peristalsis process. So we can consider it as a natural stimulant mechanism. So what are the key drugs in this class? Bran, pectin, methyl cellulose and all. But remember, for its effective action, it will take 1 to 3 days of time. And because of its natural mechanism of action, it is good for acute functional constipation. But remember, you have to advise the patient to take plenty of water because as mentioned in the mechanism, these substances will attract water and increase the bulk. So if they don't take adequate amount of water, it might lead to intestinal obstruction. So this point is very important during instructing to the patients. So the key highlights in this class of medications are advice for plenty of water intake and inform the patient that it might take 1 to 3 days for the natural mechanism to set in. In second class, that is osmotic laxatives, these substances will draw fluid into the lumen of gut. Thus, they will distend the bowel and again stimulate peristalsis. What are the key drugs in this class? Mainly, various salts of sodium, magnesium and potassium are included in this. For example, sodium phosphate, magnesium sulfate, that is Epsom salt, magnesium hydroxide, which we call it as milk of magnesia, and also lactulose is included in this class of medications. And majority of these will have bitter taste. So these osmotic agents, when they enter the lumen, they are doing osmotic drag of the fluid, leading to distension of bowel and stimulating peristalsis. For this action, they just need 1 to 3 hours of time. So we can consider quite faster acting group of medications. So better to administer these medications in the early morning. So within 1 to 3 hours, all its mechanism will be happening, leading to the evacuation, which matches with the physiological timing for many patients. And this rapid onset of action is utilized for bowel preparation before some medical procedures. For example, colonoscopy and all. So this is another added advantage we can say. Also, these class of drugs are considered safe during pregnancy. So if any pregnant women are facing constipation issue, we can definitely go ahead with this class of medications. But the only warning we should keep in mind while advising this class of drug is we have to avoid this in patients with renal failure because as mentioned, they will be having numerous electrolytes, for example, sodium, magnesium and potassium. So in patients of renal injury, it might harmfully affect in the levels of all these important electrolytes leading to adverse events. So this point we have to remember. Again, as a highlight, we have to remember that this should be avoided in case of renal failure. Why I am stressing it again and again? Because many a times we will be using these lactulose syrups as well as the commonly used ones like milk of magnesia. For example, cremaphin plus and all. In that situation, we have to keep it in mind that it is quite not good for patients with renal failure. This point we have to remember while writing this class of drugs. But the advantage is rapid onset of action and it is safer in pregnancy. Then regarding the next class, that is stimulants and irritant laxatives. So what they will do is they will stimulate the enteric neurons, helping in the release of cyclic AMP and prostaglandins. Also, they will irritate the gut mucosa, leading to secretion of water and electrolytes. So by combining these two effects, they will again stimulate peristalsis, leading to evacuation of semi-solid stool. So what are the key drugs in this class? Bisacodyl, senna, lubiprostone, etc. Mainly, you might be knowing about this bisacodyl. For example, in the name of Dulcolax, many of us might be using. But the points here to remember are, it might take about 6 to 8 hours for its action. So better to administer it at bedtime so that after its mechanism of action sets in, it will lead to evacuation with the physiological timing in the morning. So administer these medications during bedtime. But suppose if you need rapid onset of action, you can go ahead with rectal suppositories. For example, these bisacodyl suppositories are very commonly used in children for the relief of constipation because they will have very rapid onset of action within 1 hour. So this advantage we can take for patients who are being planned for some medical procedures, for example colonoscopy, but forgot to prepare bowel. So in that case, with this rapid onset of action using rectal suppositories, we can empty the bowel prior to the procedure. But important warnings which we have to remember regarding these class of drugs, because they are acting through prostaglandins and all. That's why long-term use will lead to atonic colon. Also, sometimes there will be reflex uterine contractions. So this is very, very important to remember. We need to avoid this class during pregnancy. So the highlights are, these will act through the stimulation of neurons and release of numerous chemicals as well as electrolytes. But for all of this action, it will take 6 to 8 hours of time. So administer it at bedtime. And due to involvement of prostaglandins and all, there might be reflex contraction of uterus during pregnancy. So avoid it during pregnancy, and long-term use might lead to atonic colon. And the fourth class, that is stool softeners, mainly liquid paraffin. How they will act is by adding water and fatty substance to the stool. So it will soften formed stool, leading to easy passage. So mainly the individuals who are having hard pellet like stools, or if there is excessive strain while passing stools, in these situations we can choose liquid paraffin. So the key drugs are liquid paraffin, and we can say that with this mechanism of action, it is quite naturally softening the stool. That's why for this natural mechanism of action, it might take 1 to 3 days again, just like the class 1 drugs, that is bulk forming agents. So again, while prescribing, we need to instruct the individual that the effect might be seen after 1 to 3 days of initiation. As mentioned, this class is ideal for cardiac and hernia patients to prevent dangerous straining. But remember, long-term use might cause deficiency in fat-soluble vitamins. And these drugs, if given at bedtime or if the patient lies down immediately after taking these medications, there might be chances of lipid pneumonia. So do not administer this class of drugs at bedtime. So according to the onset of action, we can say there are some class of drugs which are acting fast within 1 to 3 hours. For example, osmotic laxatives, where commonly we can use lactulose or milk of magnesia and other salt mediated agents. And there are rectal suppositories which have even faster onset of action, that is within 1 hour. For example, bisacodyl. So we can advise patients to take these medications in the early morning. And there are some other class of medications which are taking about 6 to 8 hours of time for their action, mainly oral stimulant, laxatives. So better to advise during bedtime. And few class of medications will act very slowly, that is, they might take 1 to 3 days of action. For example, bulk forming laxatives or stool softeners like liquid paraffin. So they might take little more time, that should be instructed to the patient. And regarding liquid paraffin, I have mentioned that avoid suggesting this medication during bedtime. So finally, to conclude all classes in a single slide, we can say that bulk forming agents like bran, methyl cellulose are utilized mainly for acute functional constipation. But remember, there might be chances of intestinal obstruction if there is inadequate water intake. Then osmotic laxatives, mainly the various salts and lactulose, are ideal for bowel preparation, and you might be knowing that lactulose is particularly utilized in case of hepatic encephalopathy as well. But because of this salt mediated alteration probability in electrolytes, avoid these class in renal failure. This will apply to the sodium and magnesium salts, not particularly to the lactulose. Then regarding stimulant and irritant class of medications like senna, bisacodyl, lubiprostone and all, they are ideal for bowel preparation, especially the rectal suppositories as I have mentioned, but there might be reflex contraction of uterus if used in pregnancy. So avoid it during pregnancy, and long-term use might lead to atonic colon. And finally, the stool softeners like liquid paraffin are mainly used when there is excess straining during stool passage, and it is important for patients of cardiac disease and hernia because there avoiding straining is one of the protective measures for further worsening of their underlying condition. But remember, long-term use might lead to fat-soluble vitamin deficiencies, and there might be chances of lipid pneumonia risk. So hope you have got the basic understanding of various laxative medications. And nowadays, numerous medications will be having the composition which will have agents from different classes of these laxatives. So in that case, it is very important to know the composition and think about the mechanism and to recall regarding the warning signs in relation to that particular medication. Because many a times we will not think too much and randomly prescribe the most often used medications like lactulose syrup and all. And also it is important to advise regarding the timing of intake of these medications. Hope it will be helpful in your OPD practice as well as in managing numerous patients, as constipation is one of the commonest complaints which we come across in clinical practice.